Well, great. Well, thank you very much. And thank you, everyone, for joining us here today. I'm Mike Ellis, Alberta's Associate Minister for Mental Health and Addiction. Before we start, I just want to acknowledge some folks here who are here with us today. My good friend, Alberta's Minister of Seniors and Housing, Josephine, is in the audience. Thank you very much. Lisa, thank you. Lisa Stebbins, Chief Program Officer with Karya Society for Calgary. We also have with us Susan Brooke, the Vice President of Community Impact in partnership with the United Way of Calgary and area. Thank you both for being here today. So thank you all so much for being here as we celebrate Seniors Week in Alberta. As many of you know, this year it is between June 6th and June 12th, marks Seniors Week, and what a better way to celebrate today's Seniors Week with today's announcement. A little over 3 years ago, our government was elected on a commitment to make life better for Albertans, especially those who have worked so hard to make life better for us. We've been taking significant steps to make this a reality, especially with the mental health and addiction system, where we're improving access to care, providing more options for Albertans, and removing the financial barriers to care. And we're here now to continue making life better for Albertans by helping everyday seniors improve their mental health. Today, I'm proud to announce a new partnership between Alberta's government and the community groups to expand access to mental health support for seniors. So over the next 2 years, over $6.3 million will support 4 seniors-serving organizations to support more seniors in their pursuit to improve their mental health. $1 million will support the Karya Society of Calgary's social prescribing initiative. This will increase connections between the healthcare system and community addiction and mental health supports. An additional $3.2 million for the United Way of Calgary and area for the Healthy Aging Alberta initiative. This will expand home-based personal and psychosocial and mental health supports for older adults. And $1.5 million for the Imagine Institute for Learning to deliver mental health first aid, supporting older adults training. This will focus on training staff in continuing care, home care, and seniors lodges to better support people to improve their mental health. And $650,000 for the Alberta Elder Abuse Awareness Council for service navigators for seniors. This will support seniors and their caregivers to access addiction and mental health supports. These partnerships and this new funding from Alberta's government will provide life-changing support to older Albertans in their pursuit of recovery, wellness, and of course, improved mental health. We know the last few years have been very hard. For many seniors, the pandemic has meant isolation and a loss of community, which of course is not good for mental health. We're so proud to partner with and support organizations like Karya, the United Way of Calgary and area, and others who are doing such a fantastic job to support seniors. These supports will go a long way to improve the mental health and well-being of older Albertans. And this is yet another step forward in building a comprehensive recovery-oriented system of care that helps everyone get the support they need when they need it. The recovery-oriented system of care that we're building is based on the premise that recovery is possible for everyone and that everyone should have the opportunity to pursue recovery, wellness, and improved mental health. When we say recovery in mental health, it's about being able to live a satisfying, full life while addressing and managing ongoing challenges. A life where every Albertan, regardless of age or circumstance, can have hope and opportunity, a better life, and to be supported in that pursuit. We all have a role to play in this recovery-oriented system of care, and without strategic partnerships between Alberta's government and community-based nonprofit organizations, building a better system would simply not be possible. I'd like to say a huge thank you to the wonderful people at Karya, the United Way of Calgary and area, the Imagine Institute for Learning, the Alberta Elder Abuse Awareness Council for helping make life better for Albertans. And because of your hard work, more seniors will have the support that they need to improve their mental health. The Alberta's government is proud to support you in that work. So thank you to everyone, and I'd like now to welcome my friend, my colleague, Josephine, the Minister of Seniors and Housing, to the podium. Thank you.
Good morning, everyone. Thank you, my great friends and colleagues, Mr. Ellis, for great introductions. First of all, I would like to wish everyone a happy Seniors Week. I was so pleased I was on a taper yesterday and helped the launch is about 36th annual Seniors Week in Tapered. And the first full week of June, that one of my favorite times of the years, we dedicated this week in the first week of June to recognize and celebrate all the seniors here in Alberta, their contributions, and continue contribute every day. Yesterday, I have also opportunity to declare the Seniors Week in 2022, and this year's Alberta's government proclaimed that going forward, every first week of June will be Seniors Week for Alberta. Today, I bring the Seniors Week's greeting on behalf of Premier Jason Kenney and my government colleague. I'm also pleased to be here this morning with my colleagues and friends, Ministers Associate Minister Mike Ellis, and all the community leaders. Thank you for coming and share this great news with us. Thank you all couriers for hosting us this important announcement and for the work you do. This organization has been serving the Calgarians and the cities for many decades. Our friends at couriers and in depth, all of us understand it has been a difficult 2 years, especially for many seniors. Alberta's government has been working closely with the seniors and their family, as well as a senior nonprofit organization, to deliver tools and strategy to help seniors with the challenge of the COVID-19 pandemic. This included seniors of the webinar in 2021 hosted by the Seniors and Housing that address mental health issues and affect senior living community, seniors living in facility, residents in affordable housing, caregiver, and service providers. This is a webinar focused on support and strategies for seniors to manage social isolations, establish the connections within the communities, and overall well-being. But today, we are taking another important step forward, protecting the health and well-being for seniors. I'm very pleased that $6.3 million in grant funding will be available for 4 communities, and based on the project that will support the senior mental health and addiction recovery. During the pandemic, many seniors may have become disconnected and from the friends and family. They may have the stress, lonely or isolated, and putting them at a greater risk of the reducing quality of life, mental health challenge, and substance use. With this funding announcements, we are helping seniors and the caregiver access to help they need. Alberta's governments is committed to ensuring seniors across the province have access to the service and support they need to live safely, independently in their communities. Mental health and addictions are a complex issue that require a collaborative and a cross-sector response. Alberta's government continues to work closely with each other in order of a government and community partner to identify issues and implement the solutions. This funding is another example of our community to our senior who built this beautiful province. In closing, I encourage you all to do a mental health check as on yourself, and as well as the seniors in your life and the community. Thank you so much. Now I would like to ask Lisa Stebbins, and Chief Program Officer of Karya, and step in, please.
Thank you, Ministers. On behalf of Karya and the Way In Network, I'd like to thank the Government of Alberta for this grant and the recognition that non-medical supports are social determinants of health and play an important role in helping Albertans age well in community. The Way In is a collaboration of Calgary-based agencies, Calgary Seniors Resource Society, Karya, the Calgary Chinese Elderly Citizens Association, and JFSC, and it is dedicated to enhancing the quality of life and access to services and support for vulnerable older adults living in the community and their families. The network also operates a centralized intake line, 403 Seniors, in partnership with Distress Centre Calgary and 211. The Way In network is described as a classic system community navigator program, providing outreach, supportive referrals, and case management services for older adults across Calgary. These services can also be called social prescribing, which promotes cross-system collaboration by connecting the social system to the healthcare system based on a holistic understanding of an individual's goals, needs, and the range of community-based supports that are available. Services are focused on providing person-centered services that are flexible, timely, and culturally appropriate, and take into consideration the living, working, educational, and social environments of the individual being served. Using the strength of the Way In network collaboration, the funding received for this project will build on existing integration work between the health system and the community-based sector in Calgary, as well as enhance and expand services, referral pathways to support the coordination of non-health related services that promote healthy aging in community, increase recovery capital, and improve the delivery of community-based services to older adults with psychosocial, mental health, and addictions issues. The community-based senior sector has recognized for some time that there is a need for wraparound services such as affordable housing, social services, access to basic needs, and other social determinants of health that support an individual's well-being and can have positive impacts on an individual's physical and mental health. This grant, along with contributions from other grant recipients, is a strong step forward in recognizing the value of community-based senior services and the services they provide within the health ecosystem, and the unique role non-medical supports play in supporting wellness across the lifespan. I would now like to welcome my colleague Susan Brooke, Vice President, Community Impact and Partnerships with United Way, to say a few words about their project.
Thank you. Good morning. I am really delighted to be here today, and thank you to Karya for hosting us in this amazing community hub. I would also like to share heartfelt thanks to Ministers Pon and Associate Minister Ellis for your tremendous commitment to improving the lives of seniors in Alberta. The funding announced today will go a long way to support our collective vision of making Alberta one of the best places in the world to grow older. It will ensure that seniors will have access to what they need for mental health support to age well and thrive in their own communities. At United Way of Calgary and area, our mission is to mobilize communities for lasting social change. We raise and invest tens of millions of dollars every year to build stronger and more resilient communities, improve people's lives, and find long-term solutions to complex social challenges. We do this by working collaboratively with many partners, including government, agencies, donors, community organizations, and the Indigenous community. Seniors can be a vulnerable demographic, but are also a population with great skills, wisdom, and giving spirit in our communities. We have always invested in senior supporting organizations and agencies. The creation of Healthy Aging Alberta has built capacity and infrastructure and has enabled a more coordinated, holistic approach to community-based care for seniors across the province. Healthy Aging Alberta is a provincial initiative using a community development approach to bring together senior-serving organizations and system allies united by a common vision and framework for action. In this initiative, we have the privilege of working with many partners, including the Community Leadership Council that leads this work, of which my colleague Lisa is a valued contributor. I'd like to also acknowledge and thank the Ministry of Seniors and Housing and the wonderful staff there that we work with every day who have been huge allies in this initiative. The Ministry has been a champion, a funder, a co-creator of Healthy Aging Alberta, and we would not be where we are today without their vital support. The Ministries of Community and Social Services and Health have also been strong contributors to this initiative through funding and other supports. Healthy Aging Alberta has made significant strides in a relatively short period of time due to this type of coordination and collaboration between ministries. And today, with funding from Alberta Mental Health and Addictions, we can begin work on programs that deliver a holistic range of services to support the overall mental health and wellness of Albertans. A recent survey of Healthy Aging Alberta about the needs of seniors and the state of the senior serving sector confirmed that mental health is one of the top 3 issues affecting older adults in Alberta, followed immediately by addictions. We know that coming out of the pandemic, social isolation has also been a huge issue affecting seniors' lives. That's why this funding from the Government of Alberta is so important. With it, United Way will be able to support up to 20 organizations in big cities, small towns, and rural areas of the province. Home and community-based programs and services which play a critical role in the lives of seniors and caregivers will be delivered for seniors who are experiencing psychosocial, mental health, or addiction challenges. The programs and services will provide much-needed respite for caregivers, address loneliness, isolation, and anxiety, prevent frailty, facilitate the connection to elder abuse supports, and promote social connection, participation, and mental wellness for seniors and their caregivers. Seniors will be able to access supports in the right place at the right time. And we will ensure that organizations supporting seniors are connected to and collaborating with existing mental health, addictions, and supports. We are confident the new programs and services will significantly improve the mental health outcomes of seniors in Alberta. For more information on Healthy Aging Alberta, I encourage you to go to the website. And I want to thank you again to the government for making this happen and for collaborating with the social sector on this important work. United, we make the biggest difference. Thank you.
Thanks, everyone. And we're going to go to Q&A. We've got media in the room here. So I believe, Tom, you're up first with a question there.
Just for Minister Ellis, I suppose. Just wondering, Minister, I guess in the shorter version, what would this money go towards, and what is the rationale or reason or the need for it? Well, I think a lot of stuff was explained by our wonderful folks that we're going to be giving the money to, quite frankly. But I mean, we're talking about helping seniors with system navigation, counseling services for all Albertans, quite frankly. As far as the details as to what are the specific details, I mean, I certainly welcome any one of the folks up here to come in and give some of the specifics on that. But you know, I think it was said very, very eloquently by the folks speaking here today that, you know, seniors have been significantly impacted by this, by COVID-19, through social isolation. You know, we talk about addictions, and to ensure that we have these wraparound services available to them so that they have access to mental health supports to help them with social isolation. Like even just walking around this building here, the sense of community, the sense of giving seniors in here a purpose, whether it be through art classes, whether it be through cooking, whether it be through just social companionship. I mean, those are just some of the things, but I certainly welcome one of our guests to come up here and maybe give some specifics on what your programs are doing.
For sure, with the grant that we received, we're really working on clients that have been have high involvement with the health system and that need some additional supports that are non-medical that actually prevents them from having to access the health system for things like social supports or help with getting connected to resources or getting connected to social activities in their communities. So for sure, the program that we're supporting with this grant will do outreach, will do case management supports, and really help the individuals that are requiring some extra assistance get to the resources they need and start to feel like they're moving forward towards recovery or aging well in their community.
I would just add to that that, you know, seniors who are impacted by mental health challenges are usually also impacted by other issues. So whether that's isolation, whether that's poverty, any number of issues they may be experiencing. So when we look at the person as a whole, the senior as a whole person, and having to navigate different supports and have those supports coordinated and available for them is going to make a huge difference in their journey of recovery.
Thanks, everyone. We're going to keep it short and sweet today, and that's the end of our press conference.